We had a really difficult decision to make because we have been in contract with insurance providers for many, many years. And we've just found that they are not keeping up with the times and they're really limiting what we can provide to our patients. The last thing we want is to start altering our treatment plan because we feel that, oh, the insurance plan is going to want us to do this, or they're not going to let us do this. And so at the end of the day, we're doing it for what's best for our patients. We do not want any restrictions or limitations on the care that we're providing. We are diagnosing what's there and we're creating the treatment plan that needs to happen. We're still gladly send all the paperwork to the insurance companies. We'll let them pay for their portion. But in order to keep providing the level of care that we will provide and working with the high quality materials and labs that we work with, it's really something that we needed to do in order to keep being the dental practice that our patients have come to love. An out-of-network provider is a practice that is going to welcome you in and be able to take care of you in the way that fits, our standard of care, what we want to provide for you, what we need to provide for you, and we will bill that to the insurance. But they are going to reimburse it on their own fee schedule, and we don't need to kind of stick within their confinement, if you will. An in-network provider is locked into that insurance's fee schedule and really what procedures they allow. So it just really gives us the opportunity as an out-of-network provider to provide the care Bell Dental Group needs to provide to the patients. We're able to do it again using materials that we want to, that are best for the patient, the labs that are best for the patient, and you still get that benefit. You still do get the benefit of what your insurance is going to pay from their side. It's just that we're not under contract to stick to their fees and their procedures. We never want patients to feel that they can't come here just because they hear we're not in network with their insurance. So we do work with all insurance plans. We also have different options for patients if they don't want to stick with that so-called traditional insurance plan. So we have an in-house membership savings plan that they can sign up for. This is all run within Bell Dental Group, and they're able to sign up with a yearly membership. It provides their cleaning appointments, their exams, their x-rays. They get a limited or an emergency exam, and they still get a discount on any dental treatment that they need. But they're not having to worry about any waiting periods or maximum of benefits. There's no maximum benefit with our in-house plan. It doesn't matter how much work you need that year, we're able to take care of you in a timely manner. For patients who, whether they're with our in-house savings plan or they do stick with their insurance plan, we also offer in-house payment plans for certain treatment levels. So it's just something that we really welcome you to discuss with our staff member and figure out how can we make this work for you and your family, because we do want you to get the care that you need. Deciding what's best for the patient in terms of insurance versus our in-house savings plan, it's really going to be a case-by-case basis. So they need to figure out for themselves if they want to have their insurance plan and get the out-of-network benefit still, or if the in-house savings plan would make more sense for them. For some patients, it really comes down to figuring out as an out-of-network provider, what does that look like? So it doesn't necessarily hurt to go for the full year, figure that out, see how that is. Or, what is the reimbursement like for you? And maybe when it comes time for open enrollment, they decide that the in-house savings plan does make more sense. So you just can't have both of them together. So it's either you're using your insurance plan or signing up for the in-house savings plan. And patient by patient, there's not necessarily a right or wrong answer. It is going to vary dependent on the insurance plan that you have and the treatment that you need.